Hi, this is Eric Theringer with Recordati Benefits. Recordati strives to offer you and your family a comprehensive and valuable benefits program. So we encourage you to take the time to educate yourself about your options and choose the best coverage for you and your family. The elections you make now will remain in place until our next plan year, which is January 1st, 2021, unless you have a qualifying life event. Elections you make now cannot be changed until the next open enrollment, unless you have a qualifying life event as defined by the IRS. Qualifying life events include marriage, divorce, birth or adoption of a child, along with the others listed here. So please choose wisely. Enrollment, as well as changes during the year due to a qualifying life event, are done online within Paylocity. Access to the benefit election system, which is called Benefits Enterprise, becomes available to you within 24 hours of HR approving your onboarding process. Your benefits will be effective on your date of hire, so the sooner you finish your onboarding, the sooner you'll be able to enroll for benefits, and the sooner you'll be able to get your ID cards and use your benefits. Once you are out of onboarding and log into the Paylocity system, you will land on your employee self-serve dashboard, which is screenshot number 1. To enroll for benefits, click on the gray box in the top left labeled HR and Payroll. This reveals screenshot number 2, where you click on Enterprise Benefits, and that directs you to screenshot number 3, where you will enroll for your benefits. If you need to make any changes to your elections during the year, follow this same process to request benefit changes using Benefits Enterprise. So you're probably thinking, wow, that was a lot of information, and I'm never going to remember this. Don't worry about it. This information is going to be available to you 24/7 at your Paylocity employee self-serve dashboard. So when you're through onboarding, you can go back and listen to this again, or go back and just go to the piece to figure out how to enroll, etc. In addition, we are always available to you via the Benefits Help Desk. Please feel free to give us a call. We're more than happy to help you through the process. So let's jump into the benefits. Let's start with medical. Recordati offers 3 different medical options from which you can choose. All of them have Cigna as the underlying medical insurance, but your 3 options then vary. So your first option is a PPO program, which is Cigna medical insurance without any account added to it. Your second option is Cigna medical insurance with a health reimbursement arrangement handled by Cigna. And your third option is Cigna medical insurance with a health savings account managed by Optum Bank. When you put the medical insurance together with the account option, you get your total Recordati medical benefit. Before we jump into the Cigna medical insurance, I want to spend some time talking about the differences between the health reimbursement arrangement and the health savings account, because they play an integral part in choosing which one of the 3 options you are going to pick. So understanding them becomes very important, as well as understanding the insurance side. And so let's dig in to see what we've got here. So the health reimbursement arrangement is an employer promise to pay. It's not an account in your name. They're going to commit to a certain amount of money. In this case, they're going to commit for $1,575 if you're single, $3,150 if you're family. But it's not in an account. It's there for you to use. But it's not in your name. It's a promise from Recordati to pay. On the flip side, with a health savings account, that money is actually going to go right into a bank account in your name. It is an actual savings account. So once that money goes into the account, it is yours. Very big difference conceptually between the 2 arrangements that way. One is called an arrangement, one is an account, because they are very different. Let's talk about what's eligible. With the health reimbursement arrangement, the eligible expenses are just charges that go against your Cigna medical and prescription deductibles, so a little more limited. You get more money, but what you can get back paid for is limited. With a health savings account, that expands way out. It's what they call all Section 213D expenses as defined by the IRS. Think about flexible spending accounts that you might have had in the past. Medical, dental, vision, prescriptions, even some over-the-counter medications are eligible for reimbursement under Section 213. But with a health savings account, it even expands further, adding in the ability to pay retiree medical premiums, Medicare Part B, Medicare Part D, Medicare supplement programs. So if you can use this truly as a savings account for the long term and you've got money in retirement, you can use it then. What if you want to use it for something that's not eligible? Well, in the health reimbursement arrangement, you can't. The employer promises to pay you, but only if it's eligible. With a health savings account, you can, but beware, it comes with a tax that's due as well as a 20% tax penalty. That money is going to be given to you tax-free. So if you take it out for an ineligible expense, it becomes taxable income and it gets taxed with a 20% additional tax penalty. Big incentive to use it only for eligible charges, but it is there if you need it in an emergency. Now I'm going to kind of bundle the next three together because they all kind of roll up as you make a decision. How much money is Recordati giving me? When can I use that money? And what happens if I don't use that money by the end of each calendar year? So with the health reimbursement arrangement, if you're a single, Recordati is going to make $1,575 available to you. Husband, wives, parent, child, family enrollment, you're going to get $3,150 made available to you. That money is available day one. So if you had expenses that needed to be reimbursed the first day you have coverage, you can take that money all the way up to that maximum commitment from Recordati. It is completely available for you. Trade-off, if you don't use that money during the calendar year, you didn't have enough healthcare expenses to reach that point, that money gets forfeited. It's not used. It really wasn't yours to begin with. It wasn't in your account. It's an arrangement. It's a promise to pay. So you get access quicker, you get more money, but if you don't use it, the clock resets each year. No harm, no foul. With a health savings account, you're going to get a little less. You're going to get $600 if you're a single. You're going to get $1,200 if you're a husband, wife, parent, child, or family. That money is going to be given to you on a per pay period basis, and therefore it's only going to be accessible after it's been deposited in your savings account because it takes time to get that money. But keep in mind, once you have that money, it's yours. It is yours to keep forever. It is yours to spend as you want to spend it, and you can use it at any time once it's in the account. If you don't use it by the end of the year, you keep it. It rolls over. And if you build an account balance that is over $2,000, you get to invest that money in stocks, mutual funds, bond funds, etc., the same way you would a 401k. So it is a savings account. It comes with a lot of additional features. While you get less, you get access to it over a slower period of time. You do get to keep it, and thus why the commitment from Recordati is a little smaller. You're also going to find when we get to talking about cost, that plan costs a lot less, so you can add additional money into that account. And then those gaps start to really close. How much extra can you deposit? Well, in the HRA, none. It's not your account. It's just a promise from Recordati to pay you. But in the health savings account for 2020, you can add up to $2,950 if you're a single. You can add up to $5,900 if you're a husband, wife, parent, child, or family. And again, think like a 401k. There's a catch-up provision. So if you're age 55 or older, you can add an additional $1,000 in catch-up contributions. So you can actually put a lot more money into a health savings account than you're going to get in the health reimbursement arrangement, but it will be your money that gets added to Recordati's money to put those together. So let's look at the medical insurance piece by piece. And we're going to start with preventive care because preventive care is the same across all three options. It's not going to affect the decision you make between which one of the programs, PPO, HRA, or HSA, that you choose from. Preventive care is defined by the Department of Health and Human Services, and it includes annual physical exams, OB/GYN exams, immunizations, and age-appropriate colonoscopies and mammograms. It's covered at 100%. No deductibles, no copays. But we do want you to be aware because some providers do still continue to code these services as something other than preventive care. And if it gets to the insurance company coded that way, they're not going to know to pay it at 100%. So if you find that a service was billed incorrectly, you think it was preventive care, please have that conversation with your doctor, have them resubmit the bill to Cigna as preventive care, and then it will get repaid at 100%. As we jump in to look at the comparison of the three different programs, I want to start with pointing something out that makes it a little easier. And that is that the HRA and the HSA program, while they have a different account or arrangement, the underlying insurance from Cigna is exactly the same. So if you look at the deductibles or the coinsurance or the office visits, you're going to see that everything is identical in these two columns. The variance is in the type of account and the funding to that account. So with that in mind, let's look at and compare how these programs work. Let's start with the deductible. What are you responsible to pay up front, and what does it apply to? So with the PPO program, inside the network, you have no deductible. Outside the network, the deductible is $1,000 for singles, $2,000 for families. And what you're going to see is that deductible applies to everything outside the network, but inside the network, that deductible is only going to apply to labs, imaging, hospitalizations, and surgery. Your office visits and your prescriptions are covered right away, no deductible applied. So that's kind of that traditional program that's been around for many, many years, straightforward in what it does. If we look at that PPO, inside the network, you're going to be responsible for 10% of the bills where there's not a copay. Outside the network, you're going to be responsible for 30% of the reasonable and customary charge as defined by Cigna. Out network, that's really important to keep an eye on because providers in today's world are billing well beyond what the insurance companies consider reasonable and customary. And just so you know, the insurance companies are considering reasonable and customary charges in this contract at 150% of what Medicare gets paid. So if a doctor gets paid $100 by Medicare, the reasonable charge in this contract is $150. It's not really tight, but as you begin to see what happens with doctor bills, you'll begin to understand the gaps. This is not about the insurance being really cheap. This is about providers and the way they bill to make up for Medicare payments. So that's kind of the setup and how it works at a high level. With office visits, you're going to be responsible for a copay, $20 for primary care, $40 for specialists and urgent care. Everything else beyond the office visits is covered, again, subject to that deductible and coinsurance. Prescriptions, as you'll see, jumping down a little bit, covered with a $10 copay for Tier 1 drugs, typically your brand name drugs, $30 for preferred brand name drugs, and $50 for non-preferred brand name drugs. Really straightforward, simple to use program, no accounts involved. Your maximum out of pocket, $3,000 for a single, $6,000 for a family in-network, $8,000 for a single, $16,000 for a family out network. A lot of incentive for you based on benefits to stay within the network if at all possible. So that's your PPO option. It's kind of that kind of Cadillac program, that high-end program that is out there as an option for you to choose. Let's talk about the HRA and the HSA. As we said, the benefits are the same in these two programs. Inside the network, a deductible of $1,575 for singles, $3,150 if you're covering any dependents. That almost doubles on the out-network side to $3,000 for singles and $6,000 for families. So yes, the deductibles are greater within these programs, and yes, they apply to all services except preventive. So office visits, labs and imaging, and prescriptions, you'll see deductible then in front of all of the payments. We keep it really simple in this program. Inside the network, you're going to be responsible for 20% of the bill after the deductible has met for most things, except for those office visits. Outside the network, 40%, and prescriptions, 20%. Now, I know coinsurance sometimes a little different than what people are used to, but I don't know. Think about how many times you go. I know for myself personally, you go get a prescription, pick it up. A lot of times it's a generic. Sometimes you're paying $6, $7, $8. That's below the copay a lot of times. You're paying 100% of that bill. So at many times, that 20% coinsurance is actually going to lower your cost in some places. It's a little different way to do it, but it does keep it simple from a plan design and an explanation perspective. Now, the key to the HRA, as you'll see, is Recordati is going to fund through that health reimbursement arrangement the cost of your entire in-network deductible. So think of it this way. If you stay inside the network, the first $1,575 don't have copays, don't have coinsurance, really don't even have a deductible because Recordati is going to pay it for you. So it's like having 100% coverage up to that threshold. For families, that threshold is going to be up to $3,150. After that, that's when you're going to basically have co-pays for office visits, 20% or 40% coinsurance for other services, depending on in or out network. And then we have the out-of-pocket cost, a little higher on the in-network side, same on the out-network side. But remember, that deductible expense goes to the out-of-pocket. So with Recordati giving you money for the HRA, your maximum out-of-pocket, once you have Recordati pick up, that chunk is actually going to be less than the PPO. A little more complicated. Do have to keep track of things on the HRA. Have to think about using your debit card in a pharmacy. But at the end of the day, a little more complexity, but does produce a little bit better financial outcome depending on your situation. Again, choice for you to choose from. Now let's look at the health savings account. Again, same exact medical plan, but as we talked about on the health savings account, Recordati is going to fund that account up to $600 for a single and $1,200 for a family. And I know if you looked at this on the surface, you'd say, wow, that kind of doesn't make any sense. Why would anybody do this? I mean, yes, I get to save long term if I don't use it. Yes, I can use it for additional things, but man, that's a whole lot less. We got to factor in what's the contribution out of your paycheck. We'll tackle that in a second. And once we do that, you'll see why the options begin to have some validity. And I think you're going to find yourself having to really think about what makes the most sense for you. All three programs have a telemedicine benefit built in. Telemedicine is the ability to see a licensed physician from the comfort of your home, from your desk at the office. It's there for convenience for the most part. It deals with common ailments like cold, cough, allergies, flu, congestion, pink eye. The physicians can meet with you over the phone. They can FaceTime with you. They can see what you are seeing if it's a rash. And then they can diagnose, refer, and prescribe medicine. The idea here is the cost to you is the same as a primary care physician, but the cost at a total level of the visit is an awful lot less than if you went to see your physician. So you get convenience, and then you get lower cost if it's something that's applying to that deductible in the HRA and the HSA world. By putting that together, telemedicine becomes a pretty neat benefit. And in today's world with COVID, avoiding a doctor's office sometimes can be in your health's best interest as well. So it's out there as an option, not a requirement, and you can get to and learn more about that MD Live telemedicine benefit by visiting your MyCigna site once you get up and running in the program. Now we get to see why those three options make sense for different people in different situations, because you have to factor in what's that cost out of your paycheck going to be. So this slide here gets into the details based on what plan you choose and what level of coverage you choose, or what dependents you choose to enroll in your plan is going to come out of your paycheck each pay period. Those deductions are going to be on a pre-tax basis, so the net cost to you is going to be less than what's shown because you're going to get the tax savings. But there's a definite difference. And why has the market shifted away from those PPOs that, yes, they're easy, they make life simple, is because the cost of those programs has escalated. Moving into the HRA, you get a slightly lower contribution. What we talked about on the health savings account side, if you move into that program, you get a significantly reduced contribution. So I would say if you're thinking about the HSA, think about it this way. What would that plan look like? I'll use a single as example. If instead of having $15 deferred out of your paycheck, you had $15 taken out for the contribution, and then you deferred $35 into your health savings account. Pay yourself instead of the insurance company is the concept. Save that money over time. It's not quite going to be as much money as if you were enrolled in the HRA. It's going to take a little longer for that money to build up, so it has that trade-off. But if you don't use it, you get to keep it. You get to build and invest in yourself over time, and that's that thinking and theory behind the health savings account. So as you're looking at the three options, the question becomes then, what's right for me? And you've got to marry looking at the benefits versus looking at the cost, and then looking at that HSA. What if I was to defer more money? Because that's really where things come together. So what plan is right for me?
wow, that's kind of a loaded question and certainly can get into details. But let me kind of try to simplify this down into what we usually see when these types of programs are offered. The PPO, that's just somebody who says, you know what, I want the best insurance. It is the best insurance, no argument there. I like simplicity of the copays. I don't like to have to worry about accounts and are things funding correctly. I just want to keep it simple, and I'm willing to pay more to avoid having those accounts and those hassles. So that's a PPO person. Nothing wrong with it. That's why we put the option out there. Costs a little more, but a lot of ease. The HRA, the health reimbursement arrangement. You like that idea, getting 100% coverage up to that deductible because Recordati is funding that deductible through the health reimbursement arrangement. You're somebody who doesn't have a whole lot of bills and thinks that's going to work really well for me. You also like the fact that if something happens early on in the year, you have access to that full pot of money right away. In return, you're okay with paying a little more if you go beyond the deductible because it's 80% instead of 90% that would be in the PPO. And so it does cost a little more for some of those things. If something happens, you're going to get those bills rolling through a little quicker. That's the trade-off between PPO and HRA. So you like that idea of a little more money, you like paying a little less out of your paycheck, you're willing to deal with that little bit of a hassle factor because it gives you a little bit of comfort as you go in. And then there's the health savings account. Health savings account that says, I like paying myself instead of the insurance company. I'm a risk taker. I'm comfortable with taking some financial risk. And if something goes wrong early on in the year before I get a chance to build my health savings account up, I'm okay with that. I have the cash to handle that cost if something happens to my health and I end up with some large bills early on. I'm going to use that lower contribution to build my health savings account nest egg for future medical expenses. And so I'm looking at this as an investment in the long term, and I think that's going to work for me. So again, 3 different plans, 3 different types of people. Really has nothing to do with age, has nothing to do with single, husband, wife, parent, child, or family. People say sometimes, well, that health savings account's for the healthy person. No, I would argue there certainly are people I know who have said, I will pay the health savings account I will fund it to its maximum. It's all about saving for my future and my retiree medical costs. I'm going to pay all of my healthcare costs that are out of pocket today out of my pocket on post-tax money because I want to save for the future. So there's lots of different ways to do these things. There's no simple answer. You got to work through it. So if you're sitting here going, wow, I'm still not sure what's right for me and my family, totally understand. Please feel free to give us a call at the Benefits Help Desk. We'll give you that number at the back end of this presentation. We are more than happy to talk about your situation, talk through options with you, and help you make that decision.
Your dental benefits are insured by MetLife. Whether you use in-network or out-network providers, you have a $50 per person deductible, and that deductible is capped at $150 per family. The deductible applies to basic and major services only. Preventative services like periodic checkups and cleanings and x-rays are covered at 100% with no deductible. Same in-network and out-network, so not a lot of differential as you look to use in-network or out-network providers, but that changes when we get into basic and major services. As you'll see, basic services, those are things like fillings, periodontia, and endodontia, are covered at 100% inside the network after the deductible versus 80% out of network. Major services, things like crowns, caps, and bridges, 60% in network versus 50% out network. Those benefits, preventive, basic, and major, all roll up towards your annual benefit, maximum benefit of $2,000 per person. So an additional reason to use in network, the negotiated fees paid to network providers are a little less than those paid to out-network providers, making that $2,000 maximum benefit last a little longer. Finally, for children, there's orthodontia coverage up to age 19. The plan will pay 50% of that expense up to $2,000 per child per lifetime. To find a MetLife in-network dentist or to track your claim history, set up your personal MetLife account. Like medical, if you enroll in dental, you will share in the cost. Your contribution for pay period is outlined below based on the level of coverage that you select, And like medical, this contribution will be made on a pre-tax basis, saving you the tax money on the money that you've deferred to pay for your dental cost, making that net cost even less than what you see above. Your vision benefits are insured by IMED. You can receive care from an in-network or out-network provider. While the frequency with which you can receive benefits is no different, once every 12 months for exams, lenses, or contacts, and once every 24 months for frames, the benefits are far superior in-network. In-network, you will have low copays of $10 for an exam or $25 for lenses. You have a frame allowance of $130, plus you receive a 20% discount on the cost of frames above the allowance, or a 15% discount on the cost of contacts above the allowance. Compare that to the out-network side, where you receive up to $30 towards an exam, $60 towards frames, $25 to $60 towards lenses depending on the type, and $104 towards contacts. Definitely a better benefit inside the network if you're willing to use an IMED provider. IMED's network is a combination of independent optometrists as well as many of the large chains. If you can use an in-network provider, certainly going to get a better benefit at a much better cost. To locate an IMED network provider near you and to track your claims, set up your personal IMED account. Like medical and dental, you're going to share in the cost of the vision program as well. Contributions per pay period are outlined below, and similarly, those contributions are going to be made on a pre-tax basis. Flexible spending accounts are ways to save on taxes by deferring your pay on a pre-tax basis to pay for out-of-pocket expenses, including medical, dental, vision, dependent care, and commuting expenses to and from work. Deferrals come out of your paycheck before taxes are calculated, saving you 25% or more on every dollar you defer. FSAs are great for known expenses because you are paying for services with pre-tax dollars instead of post-tax dollars. And the flexible spending account deferral elections must be made during open enrollment or the initial enrollment for new hires, and you cannot change your election during the year except for the commuter costs.
There are 4 different types of flexible spending accounts. First, we're going to start with the healthcare flexible spending account, which is the most common one you may have known about. This program is for people who have enrolled in the medical PPO program or the medical HRA program. If you are in the healthcare savings account program, the HSA program, we'll talk about that program in a second, the flexible spending account for you. So again, for PPO and HRA plan members, the healthcare FSA is there to cover medical, prescription, dental, orthodontia, and vision expenses that are not covered by your insurance or by your healthcare reimbursement arrangement. Keep in mind the order of use so that if you're in that HRA program, the company-funded HRA will be used before your personal flexible spending account money. So that gets into budgeting. Be sure you defer the right amount of money based on the plan that you're in. The maximum deferral for the 2020 calendar year is $2,750. Your entire healthcare flexible spending account is election available immediately. You don't have to wait for that money to defer. That's a little different again from the folks in the healthcare savings account where you have to wait till the money is there. So again, that money fully is available, whatever the election you make, right up front, and then you'll continue to pay it back through the rest of the calendar year. But do be careful because you can only roll over up to $500 of unused deferrals into the next plan year. Anything beyond that is going to be lost. It's what they call the use it or lose it rule of flexible spending accounts. So you get that tax advantage of deferring the money before taxes. That's the win. You do have to use it though during that tax year because anything over $500 is forfeited. Second kind of flexible spending account is the limited healthcare flexible spending account, and this program is for the HSA plan members only. The difference with the limited FSA is that no medical or prescription expenses are eligible. It's only for dental, orthodontia, vision, and the over-the-counter medications that otherwise would not be eligible under a medical plan. Why is it structured this way? Well, remember, if you're in the healthcare savings account program, you are putting money aside. You get a much bigger amount of money than the limitations on the flexible spending account, and that money gets to roll over year to year. So you want to maximize your healthcare savings account first, and then you want to use your FSA for non-medical expenses. The maximum deferral is the same. The program runs the same as a typical healthcare flexible spending account. The rollover rules are the same, but again, the difference here, it's only dental, orthodontia, and vision.
The Dependent Care Flexible Spending Account is used for daycare expenses for your dependent children or elderly parents so that you and your spouse can work or pursue an education. You can defer up to $5,000 into a Dependent Care Flexible Spending Account, or $2,500 if you're married and filing taxes separately. Unlike the Healthcare Flexible Spending Account, dependent care funds are only available after you have contributed the money. Again, be careful, because unused money at the end of the year is lost. There is no rollover with dependent care flexible spending accounts, so budget wisely.
The commuter flexible spending account is used for transit and parking expenses in getting to and from work. Transit expenses include all forms of mass transit as well as van pool fees. Parking expenses include fees for lots at or near a mass transit station or at or near the office. There are a few things that make the commuter FSA unique. First, you elect a monthly deferral amount, up to $270 per month for transit and up to $270 per month for parking. It is two different elections with two separate maximums. Your election will continue from month to month until you change your election. Second, you can change your monthly deferral at any time during the year and effective the first of the next month. So if the fees for your transit change and your account is overfunded, you can modify or pause the deferrals until you are back on track. Finally, the commuter FSA does not follow the use it or lose it rules. Instead, any unused money is rolled over into the next month. So if you use public transportation or have parking fees, the commuter FSA is a great way to reduce your taxes.
Recordati provides all employees with life insurance insured by principal, equal to 2.5 times your base annual earnings, up to $300,000. The benefit is reduced for older employees. One nice feature of the plan is the ability to access up to 75% of the benefit to help you pay for care if you become terminally ill. That money can also be used for other expenses at your discretion. It's just nice to know that it's there if you need it. The life insurance premium is fully paid by Recordati, but the IRS does require employers to report imputed income for premiums in excess of $50,000. Your imputed income is reported on your W-2 at year-end, as well as on each pay stub, and you pay taxes on this premium. The good news is, by following the IRS rules, the benefit, if it's ever needed, is tax-free to your beneficiary. Recordati provides all employees with short-term disability insurance. The benefit provides you with 66 2/3% of your base monthly earnings, up to $1,000 per week. Benefits begin after you have been disabled for 1 week and continue for 12 weeks or until the long-term disability benefits begin. For those who work in New Jersey, you still have the state's mandatory short-term disability benefit, which pays first. The principal short-term disability benefit will then supplement you up to that $1,000 benefit limit. Recordati also provides all employees with long-term disability insurance insured by principal and equal to 60% of your base monthly earnings, up to a maximum benefit of $10,000 per month. Benefits begin after 90 days of disability and continue until you are no longer disabled, reach age 65, or reach your Social Security normal retirement age. Most long-term disability benefits are considered taxable income to the disabled insured. However, Recordati long-term disability benefits are tax-free. When your company pays for long-term disability, your long-term disability benefit is taxable. While not required by the IRS on LTD, Recordati uses that same program called imputed income, where you pay tax on the small premium today so that your benefit is not taxed and you take home more money when you need it most. Taking an example from the chart, someone with a $100,000 income would get $3,500 a month without the use of imputed income. Compare that with the $5,000 a month benefit using the imputed income approach. That's an increased benefit of $1,500 a month or $18,000 a year, year after year, when you are disabled and the cash is needed most. Our Employee Assistance Plan, or EAP, is with Magellan Health. An EAP provides confidential 24/7 phone consultation with licensed mental health professionals, as well as an online library of articles, self-assessments, tools, and calculators. Services are available for anxiety, depression, and stress management, handling relationship issues, addressing drug and alcohol problems, caring for children or aging parents, dealing with conflict or violence, walking through grief and loss, legal and identity theft issues, financial planning, weight loss and smoking cessation, as well as fitness and wellness planning. Our employee discount program is with Tickets at Work. Tickets at Work provides you with access to exclusive savings on movie tickets, theme parks, hotels, tours, Broadway and Vegas shows, and more. Examples of the discounts include 25% off at Six Flags, 30% off at AMC Movies, and 30% at Universal Studios. Instructions on how to become a member are located in our benefits website. But the biggest challenge here is just remembering you have the program, especially for those movies, because those savings are great.
So a few final parting thoughts. First, after you get your onboarding done, remember, log back into Paylocity the next day to complete your benefit enrollment. Do this as soon as possible. Don't forget, because those benefits start on your date of hire. You can do this in advance of being hired. It's, again, just a matter of getting your onboarding done and approved so that that data feeds over into the benefit enrollment system and you can go into Benefits Enterprise and do that. Second, reminder, we haven't talked about 401k here, but you have a 401k benefit with Recordati, and they match 100% of the first 6% you defer. And like the benefits we've talked about here, you're eligible for 401k on your data hire. So again, once you get through onboarding, go look for that information on your self-service dashboard, learn about the 401k program, and get enrolled so you can take advantage of that match. If you need more information about any of the benefits discussed here, you need a claim form, please visit our benefit website. Recordati's benefits website is accessible from the Paylocity Employee Self-Service Dashboard. It's right there to click on. It will link you right out to the benefits website. And finally, if you've got questions, if you need assistance during the year, you got a troubling claim problem, please, by all means, give us a call at the Benefits Help Desk. Danielle answers most of those calls. She'll be glad to help you out and answer any of your questions. Thanks to everybody, and hope you have a great day.